Hi, welcome back. This is Joel, your host for Advantage Seniors Channel. And today we're going to really begin to look again into more depth regarding Medicare and the issues that surround it. I believe at this point it would be very good to take a look at what and how Medicare defines providers of medical services. So we're going to be looking at the different types, whether they be an MD or an osteopath or chiropractic, that type of thing. And I consider this to be looking at it as a medical supermarket of choices. And that's where the difficulties and the issues arise. And again, here is my email address, and would love to hear from you. Always looking to improve, and for that, I need your feedback. Before we begin, I again want to go through an agenda, which I do on every episode. The reason for this is that you have an idea of what is coming and what is going to be in the episode and presentation. And today we will do a definition of healthcare provider types. And you're soon going to comprehend why I put together an episode on this topic, because it is a rather interesting and in some respects controversial topic. So we're going to differentiate provider types and look at the strengths and challenges that each one of these types face. And the bottom line you will see is that perhaps the best approach in using the providers and so forth is to use a teaming approach to get the benefits of each type. So it'll be MD versus DO versus DC versus DPT versus NP versus PA. I trust that you're sufficiently confused. The number of medical provider types has expanded exponentially over the last few years. Therefore, the purpose of this episode is to provide the details on the benefits, the functions, the limitations, etc. of healthcare providers. And my objective is to assist in helping the viewer make informed decisions in selecting the appropriate provider types. And as usual, I have the bottom of this slide here, which shows the flow of analysis that data collection, which I have used to result in the information which I am providing today. And that overall purpose is to allow you all out there to make informed decisions. Please contact me either by the email or by writing in the comments below, and I'll try to go into greater detail when I respond. By way of introduction to this topic, I had previously called what we're facing here with the different types of providers a medical supermarket. So what does that mean? Delivery of healthcare has become like the shelves of an overstocked supermarket. To bring that into more clarity, what I mean, I'll share with you a short story. One of the people who was on my team at this major engineering company had just emigrated to the United States from the Ukraine. This was at the time of Chernobyl. And he brought with his wife and himself, his mother, and they went one day into a supermarket, and the mother walks into the supermarket with them, and some reason stops off at the tomato sauce shelf where they sell tomato products. She takes one look at it, and she collapses. Isn't that strange? Actually not. The reason why she collapsed is she came from a country very much different from our own, where they had no choice about anything they ate. They were lucky, frankly, just to get food. Here we have the opposite story. We have perhaps an overabundance in our stores, although certainly it's getting more expensive. So, like the supermarket analogy, healthcare providers appear to come in a confusing variety of flavors. And we're going to go through each one, from MD, medical doctor, to DPT, which is doctor of physical therapy, and others. And you'll see why that's important. And so if you have all these choices, how do you make an informed decision? How do you make an informed choice? All right, let's start off in the easiest manner possible by providing definitions for what is called credentialized Medicare providers. A credentialized Medicare provider is somebody, or it's a group of providers that is allowed, or a group of so-called physicians who can provide detailed Medicare help as a primary. The first are physicians. Second are credentialed healthcare providers overall, other ones. Physicians include doctors of medicine and doctor of orthopedic medicine. And finally, in some cases, a dentist, a podiatrist, an optometrist, and a doctor of chiropractic. Okay? So those are the ones who are basically, in the past, been able to provide medical care. Other credentialed ones are clinical nurse specialists, clinical psychologists, clinical social workers, and nurse practitioners. Even an occupational therapist, a physician assistant, a physical therapist, and a speech-language pathologist. They have increasing responsibilities and increasing powers. Some of them you'll see down to the ability of prescribing medication, even though they do not come up to the level of an MD or a DO, for example. Okay, now let's take a look, let's continue on the definition of healthcare physician types and go into more detail to achieve a description of each one. So we have a doctor of medicine, and then a doctor of osteopathic, a doctor of chiropractic, and a doctor of physical therapy. The MD is trained in what is called allopathic medicine, and their focus is on treating symptoms and diseases using drugs, radiation, or surgery on the diagnosis and treatment of the disease. Okay? Doctor of Osteopathic is a bit of a difference. They treat so-called whole person approach to medicine. They treat the entire person rather than just the symptoms. And their focus is on preventive health. Their philosophy is to help develop attitudes and lifestyles that don't just fight illness, but help prevent it too. I know a lot of that MDs do the same thing, but an osteopathic doctor, that's his basic focus in life. And then we have a doctor of chiropractic who also treat a variety of problems that are related directly to the neuromuscular skeletal system, which are our bones and our nerves. Their focus is different. They focus on nutrition and exercise to help the body fight off disease processes. And their goal is to improve the body's motion and function while reducing other symptoms. So they have a much different charter and therefore bring something else to this party. And then we have a doctor of physical therapy who were not included until recently into provider types. They are experts in movement, similar to a doctor of chiropractic medicine, to help patients regain normal functional mobility after an injury or illness. And their whole thing is to restore active daily living activities to promote normal independent living. Much more straightforward or less inclusive than a doctor of chiropractic medicine. Okay. Let's look at the education, training, certification, and licensure. A doctor of medicine, again, the direct doctor of osteopathic, doctor of chiropractic, doctor of physical therapy. Might be surprising. Education is rather similar. An MD has a 4-year undergraduate degree. He or she must pass an exam, even to start to apply for medical school. Afterwards, after finishing medical school, they will get a 4-year medical degree, an MD. They will then do a 3-year residency for each specialty, then pass a national board exam, and then pass a state exam. That's a lot. So these are rather highly educated people. Okay, well, we have a similar type of thing with a DO. They also have a 4-year undergraduate degree. They must pass the MCAT exam, after which they get a 4-year doctor osteopathic, but their education is different. A 3-year residency per specialty. They must pass the national board examination, and then pass a state exam. So it's very similar on the surface, but the topics and things that they study between the two are very much different, or can be. And then we have a doctor of chiropractic. Looks like the same thing. A 4-year undergraduate degree, 4-year chiropractic degree. They must pass the national board exam and pass the state exam. So there's a bit missing here in terms of the residency, for example. Okay, so that's not here. And then we have a doctor of physical therapy, also a 4-year undergraduate degree, a 3-year physical therapy degree. not 4. They must pass a national exam, and then they must pass the state exam. So you can see there are some differences in the education, some of which might matter, some of which might not. And this is open to debate, and so I'm not going to get into it except to point out that there are these differences. So that begs the question of when should you utilize the particular expertise of these individuals. All right, we'll start with an MD, the DO, the DC, and the Doctor of Physical Therapy, a DPT. MD, common illnesses, yearly checkup, breathing problems, cardiac issues, ear, nose, and throat conditions, and so forth. We are familiar with that. All right, now this is a little bit different. They do fulfill similar roles. However, Doctor of Osteopathic Medicine completes additional hands-on training in a technique termed osteopathic manipulation medicine, which is movement. So they have a different emphasis. Although today, the way it's practiced, they're very, very similar. Chiropractic doctor does musculoskeletal issues, back pain, neck pain, some minor injury to the foot. For example, I'm sure we may have all gone through this, is an ankle injury from playing the famous pickleball. Range of motion restriction and preventive treatment to maintain musculoskeletal health. Okay? So you can see again, there are some aspects which are similar, but in terms of a DC, it's practically everything involving the musculoskeletal neurologic systems of people. And then the DPT fills the need for occupational therapy, helps combat disease-related conditions, for example, type 2 diabetes, cardiovascular rehabilitation, etc. Okay? All play an important and specialized role in people's health. That's the bottom line. All right, but there have been changes now. The stew is getting thicker. And now we're going to talk about physician assistants and nurse practitioners who you will come across. There is a rapidly developing trend in the healthcare delivery environment, and that is the utilization of physician assistants and nursing assistants. I'll let you guess why. Okay, so a nurse practitioner, after starting their careers as registered nurses, they pursue a graduate nursing degree at the master's or doctorate level. Okay? They're responsible for handling patient appointments and performing routine examinations to ensure patient health. Their duties include speaking with patients about what healthy lifestyles are, don't smoke, don't eat, completing diagnostic tests to help diagnose and treat patients for illnesses and injuries, and coordinating with the information with other professionals to maintain updated records. They enter information. A PA is a healthcare professional who has completed a master's degree in medicine. Okay, that's a master's, not a doctorate, and trained to provide services under the supervision of a doctor. A nurse practitioner does not have to necessarily work under the supervision of a doctor and, one of those other providers. Work in many different settings. You'll find them in hospitals and clinics. And they help patients with their routine medical care, such as physical exams. They do diagnose illnesses and ordering tests and procedures and writing prescriptions. Okay? I would remember this and go back to it because given the trend within the industry today, it is important to understand the roles of each of the providers which we have listed. All right, now we get into the controversy of nurse practitioners and physician assistants. I'm just going to present the facts and what people say about it. And again, it's up to everybody listening to come to their own conclusions based upon the actionable information which is being provided. Okay. So this is it. Nurse practitioners are registered nurses with additional education and clinical training, as we said, master's or doctoral degree. The nurses must complete at least 1,000 hours of clinical practice in a focused area, a specialty, for example, pediatric, adult, or generic medicine, to earn this degree. Although they can pursue additional training, such training is not required. They do not have to take a residency. Remember that. State nursing boards license and regulate NPs who typically recertify about every 5 years. However, requirements, for example, recertifying intervals, continuing education, and so forth, vary amongst the states. So it's not going to be, your requirements are not going to be the same across the country. Okay? Nearly half of the states authorize nurse practitioners to practice independently without any oversight. However, in all states, the NPs have full prescriptive authority, including the so-called controlled substances, which are, of course, the narcotics. Physician assistants, even though it might sound better, I don't know, interesting term, they train for 2 years, frequently alongside medical students, and they receive a master's degree. They do complete at least 2,000 hours of supervised practice before graduation. Like NPs, PAs can also pursue additional training specialties, and the state medical boards regulate PAs who must practice with a supervising physician, although that extent even will vary state by state. They have to maintain their certification, and they must complete 100 hours every 2 years of continuing medical education and take a recertification exam every 10 years. Okay? Just about every state, the PAs can write prescriptions. Kentucky does not allow PAs to prescribe controlled substances. This is so interesting, the two of them, and it really takes time to understand what the differences are and what the costs and risks and benefits are. In contrast to NPs and PAs, a typical family physician completes 15,000 hours of clinical work over 5 additional years of training, including residency. This enables primary care physicians to generate broad differential diagnoses and provide care to medically complex patients. There appears to be a difference, just in reading this, between the level of training and knowledge of these two types of categories versus the others. May not be as robust. Well, you're going to get, it's depending upon where you get your service, people will say to you, the administrators, the nurse practitioner will see you now. What does that mean? It's a phrase that not everybody is accustomed to hearing, because people are used to going in and seeing the other doctors type. But it's increasingly become the case. Patients are more likely than ever to see providers such as physician assistants and nurse practitioners instead of doctors. Okay? The physician shortage, a growing demand on healthcare, and more people graduating with these degrees helped expand the presence at physician offices. That's great, but what does it mean for us as patients? Studies show that patients have similar health outcomes depending upon who has written those studies, of whether they see a physician assistant, or a nurse practitioner in the primary care setting. But the jury is still out in other settings, like emergency departments and specialty care. Okay. How do they fill in the gaps due to the fact that the number of physicians are decreasing? Health experts say the best way physician assistants and nurse practitioners fit into the landscape is in a team setting alongside or under the supervision of physicians. They can be especially important in some of the faster growing areas such as mental and behavioral health, geriatrics, and rural medicine. Well, we understand what the problem is in rural medicine and in geriatrics, which we all belong to. It's difficult to find a good provider. So you may have to use them, but you have to go in with your eyes open, because it's important not to overlook their limitations. I'm not saying they don't do a good job. Please listen to this. But there are these differences in expertise and in training and in education. So, use your own head. Figure this out. Who would you rather see? So this is this. So how do we decide? Okay, we're going to come to that. The bottom line is, thankfully, there's no need to choose. It is best to build a Medicare-sanctioned team. And this team has overlap, complementary overlap. They involve all the players with their strengths and cancel out the weaknesses. The advantage of overlaps and the complementary skills are obvious. You're getting the best of all worlds here. To me, that's the bottom line. It's a matter of the way things are today. We have to learn how to take advantage of it to the best extent possible to make the best out of it, but still go in with our eyes open so that we can form the best team that we need. In any event, you may not have a choice. All right, the next session will be an introduction to what I call the pharmaceutical maze, Medicare Part D, and I think I'm going to basically blow your socks off. This is an area fraught with difficulty, and I don't know what else to say. You're going to see it in the following, beginning in the following session. Please remember to like and subscribe to this channel. These presentations are not easy to put together. They take a lot of time. You know the drill. It will help us, and hopefully we are helping you. So let me say that goodbye, and look forward to seeing you participate in the next session. Thank you.